Alrighty guys, what's going on? Tyler here with Boards, Preps, and Projects, and today we're going over Prepper Medical, the basics. So, I've got my nice little Red Cross on the shirt, so you know it's legit. Keep in mind guys, disclosure, I'm not a doctor. This is not medical advice. Wink wink. Just trying to help you out. So, there we go. Lawyers are happy. Guys, I haven't always, my family hasn't always had the money for going to the doctor and for going there for every little thing. So we learn to improvise, especially if you're on the poor side of the money structure. So you'll learn to go ahead and get some chicken soup, some Sprite, some crackers. You're going to get over the flu, going to the doctor for it. Nope. Unless it's a true damn emergency, we are going to avoid that bill. Now, that will actually be a huge staple after things collapse, because it won't be the bill you're avoiding. It'll just be the fact that a doctor isn't around, unless if you are extremely lucky and have a doctor in your group. So with that line of thinking there, I know that a lot of things can be solved, and all my guys in construction and in mechanics and carpentry, roofers, you guys all know that some duct tape and a dirty rag can take care of a whole lot of wounds, especially with a little pressure. I've been there plenty of times, done it many times. Avoiding having to go to the doctor and just taking care of it on the job site, staying on the clock, getting your ass back up there, get back to work. Now, this video, which I'm making sure to tell you guys, that does work for a lot of things, but this video is about for stuff that this won't handle as well. And this will just get you guys a little more prepared, because if the doctor isn't coming after the collapse, it's where you're a little less screwed, or you have better odds of survival. So we're going to move right along to med kits. They got ones like these, and sometimes they're in plastic or in a bag. And generally you can pick them up for around like 10 bucks all the way up to 50 bucks at most of your major grocery stores. Now, is this better than nothing? Yeah, it is. Slightly. And really it's because it's kind of a ripoff. Whenever you open up these kits, they'll have, and like on the outside of this one, a list of contents. You're going to buy one of these, check the contents out, make sure that you're getting more than just a handful of Band-Aids, a couple of gauze pads, some alcohol wipes, and a couple little packets of acetaminophen or ibuprofen, because generally that's what these kits carry. They don't have capabilities beyond minor cuts and scrapes. Sometimes they'll have burn gel and things like that in there, but you get such a minuscule amount that to me it's not worth it. Instead, I would opt to say, advise you guys go ahead and put together your own medical kit. And this, it's in plastic, it's in a Tupperware, but it's a more complete wound care kit than what I could buy for the money that I've invested in this. And in making your own, the Dollar Tree is your friend. For instance, right here is, I think, 50 yards by 3 inches wide gauze. Now it's sterile, they're all in their own individual packs, and you can get these little rolls for $1.25 now. Yeah, ain't inflation a bitch. You can get these for $1.25, and they'll take care of most of your issues, especially if you combine it with some duct tape. Now, my carpenters and mechanics out there, you guys know when you get your knuckles scraped real bad or you get cut, that it's hard to keep a Band-Aid on that area. What's worked for me plenty of times has been take the gauze, go around it a bit, take the duct tape on the part of your thumb or finger that doesn't have a crease in it, that doesn't move, tape it down, and it works a lot better than any of the Band-Aids you can get. So, pound for pound, I think that you can get better quality and more quantity for around the same amount of money, putting together your own medical kit than you will for buying one of these off-the-shelf first aid kits. More serious stuff, like a tourniquet. If you get a real bad laceration, a gunshot, or a broken leg with the bone sticking through, the possibility of bleeding out is extremely bad, and might just be what takes you out. It doesn't take long to bleed out. Now, one of these right here will stop that from happening. You're not going to find these in most medical kits, and you can pick them up from North American Rescue. Now, one of the things you can pick up off Amazon, which I'll have linked in the description below, these right here. They come with this package wrapped on the outside. These are for your big boo-boos. And this right here will put a ton of pressure on the wound. It is a Israeli field bandage, or this is kind of an off-name brand. It's just called trauma wound dressing. And these are actually pretty cheap, but if you need one, you'll be real thankful that you've got one. And we're talking about blowouts and bleeding out. We want to prepare for the more serious emergencies. Something like a high vent chest seal from North American Rescue would also be good to, not expire. So that's more of the blowout stuff right there to help with major, right now, need to get yourself patched up to where you can't go and get some medical help from somebody else. When it comes to books, I've got some new books and I've got some thrift store books. Now these right here, one of the ones that I see most often, and I think it's $1 for paperback books at Goodwill, but I see these there all the time. That is the pill book. Now, is this going to be the most updated version? No, but say after the collapse you're going around and you happen to find some medicine in a structure that nobody's using anymore, somebody's house, or car, or whatever, and the bottle's not labeled. Or maybe it is labeled, but you just don't know what the hell it is. Like, you have the scientific name there, but you don't know what the medicine's actually for. This right here will help you. Along with the Merck manual, I've got a book on diagnosis medical dosage calculations, over-the-counter and prescription drugs, the Drug Identification Bible. All these books would have cost me a lot of money to buy new, and over the course of, maybe a year or two, I've been able to pick all these up from Goodwill and other thrift stores and spent at the max $3 on them. That is for the hardcover. Definitely keep an eye on thrift stores. When it comes to new books, which I'll have links for in the description because I got them off of Amazon. The Prepper's Medical Handbook, that's a good one. And then also, these guys have their own YouTube channel, which I'll link in the description as well. And here's their two books, the Survival Medicine Handbook and the Ultimate Survival Medicine Guide. Now, written by same authors, Joseph Alton and Amy Alton. They know what they're talking about. They cover A to Z in these books, everything from a bad tooth to childbirth to tetanus, and I even believe typhoid. Also, they've got a list of medications in these books that are for your fish antibiotics that you can get without a prescription. So keep that in mind. And I'll probably be stocking up on some of those myself. But these books, definitely a must. I'm not a doctor, I don't have all the knowledge. But one doctor happened to put a lot of the knowledge to maybe just get you through right there. Let's talk about aftercare. So you get yourself stitched up, you get yourself whatever, and now there's a problem with infections and pain. Now for infections, a couple of the most practical is going to be hydrogen peroxide and rubbing alcohol. Now rubbing alcohol, it's going to hurt like hell, but I have used it. It will disinfect, although it does burn like hell. So keep that in mind. Hydrogen peroxide is a little more forgiving, but you want to keep your wounds clean. So part of the basics is having a stockpile of one or both items, because infections are a bitch, especially if you don't have antibiotics. Pain, without going to the back alley and handing over a fistful of cash to try to get something under the table without a prescription, that's up to you. I'm not advising you do it. OTC meds is about the best that we've got. Now, just ibuprofen, acetaminophen, that will help with pain some. Now, with prescription meds, please keep in mind that people say that they expire after a year, that they're no longer good. That is a myth. That is absolute bullshit. Do not believe it. Prescription meds will be good well past a year. They will just slowly start to lose their effectiveness after 1 year. So if you find some medicine and it's a little old and you want to add it to your stockpile, add it to your stockpile because it's better than nothing. Last but not least, practice. I don't know a damn thing about stitching, but I'm going to find out and see if I can use this kit right here to try to actually figure out how to do it. With this kit right here, which I bought off of Amazon, and I'll see if I can get a link for you in the description as well. You open it up, and inside you've got a couple useless papers. You've got a few sterile needle and thread ready to go in here. With this though, I also bought some mixed surgical sutures, just different kinds. They've got silk, nylon, polyester, polypropylene, and the needle and everything's already included. This stuff is not that expensive, but the real meat of this potato is when you get in here, you've got some tools. A little bag, and obviously guys, this is going to be cheap tools. You've got some things here to go with your stitching kit, as well as some skin to practice on with some cuts already made in it, and a place over here for you to make some of your own cuts to see how well you can do at stitching them up. Am I going to be a master suture guy, whatever you call it, human seamstress after this? No. But I might be slightly more prepared to do this myself if I have to, or to help another person out if need be. So practice and training. If there is somewhere in your vicinity or area that is putting on training that you can pay for, I'd say go ahead and do it, because that knowledge will be worth its weight in gold after the class. And it might just save your life or the life of someone else in your life. Well guys, this here has just been the basics of what I recommend you get started on as far as medical. I'm not an expert, but with what I have here, I'm better off than most people. Well, get your medical stuff stocked up, get you some knowledge, and some practice and or training. No excuses. Links will be in the description below for books and for practice kits. Also, check out Miss Nature Prepper. Link for her channel will be in the description below. Guys, that's about it. Tyler with Boards, Preps, and Projects. Have a nice day.